Welcome to the ATC HSSC online training series. In this session, you will learn the correct procedures for donning and doffing personal protective equipment, PPE, a critical infection prevention practice that helps safeguard both healthcare workers and patients by minimizing the risk of contamination and cross-infection. Donning. Donning refers to the process of putting on personal protective equipment, PPE, correctly and in the proper sequence to ensure maximum protection against contamination and infection. Key rules. First, clean your hands frequently to reduce the risk of infection and maintain hygiene while handling sterile or clean equipment. Second, touch only the inner surfaces to avoid contamination. Third, always remove PPE slowly and carefully to prevent the spread of contaminants and ensure safe disposal. Donning sequence. Donning is done in a fixed order to create a complete barrier: hand hygiene, gown, N95 mask, eye protection, and gloves over the gown cuffs. Step-by-step donning procedure. Step 1. Hand hygiene. Begin with proper hand hygiene using an alcohol-based hand rub. Thoroughly clean the palms, between the fingers, thumbs, and fingertips. Effective hand hygiene helps reduce contamination and ensures safe PPE application. Step 2. Gown. Put on the gown by sliding your arms into the sleeves one at a time. Pull it up so it fully covers your torso and arms. Fasten it securely at the neck and waist to keep it in place. And ensure the sleeves extend to your wrists with no exposed skin. Step 3. N95 mask. Place the N95 over your nose and mouth and pull it under the chin. Now secure the mask by placing each side strap around the ear one at a time. Make sure both straps sit comfortably and are not twisted, so the mask stays firm on the face. Finally, mold the nose clip firmly to your nose for a better seal. Step 4. Eye protection, face shield. Hold the face shield by the strap or side arms, avoiding the clear front. Place it on your forehead and pull the strap over your head. Then, adjust it until it feels snug and stable, making sure it fully covers your eyes, nose, and mouth. Step 5. Gloves. Finally, wear gloves and pull them over the gown cuffs. Check that there's no gap at the wrist. This completes your PPE barrier. Final donning check. Before entering the patient area, do a final quick check. Mask secure, gown tied, eye protection stable, and gloves covering cuffs. Doffing. Removing PPE. Doffing refers to the safe and correct removal of personal protective equipment, PPE, to prevent contamination and the spread of infection. Why doffing needs care. Doffing is where most contamination happens. Assume the outside of PPE is contaminated. Remove slowly and touch only straps or inner surfaces. Doffing sequence. Gloves, hand hygiene, eye protection, gown, mask, N95, hand washing with soap and water. Step-by-step doffing procedure. Step 1. Remove gloves. First, remove your gloves using the glove and glove method. Pinch the outside of one glove near the wrist and peel it off. Hold that removed glove in the still gloved hand. Then, slide your fingers under the wrist of the remaining glove and peel it off over the first glove, so you don't touch the contaminated outer surface. Step 2. Hand hygiene. Perform hand hygiene using the WHO hand rub steps, rubbing all hand surfaces until dry. Step 3. Remove eye protection. Remove eye protection by holding the strap or side arms. Don't touch the clear front. Lift it away from your face. Step 4. Remove gown. Now remove the gown. Untie it, pull it away from the shoulders, and roll it inside out as you remove. so the contaminated outside stays folded inward. Step 5. Remove N95 mask. Do not touch the front surface. Hold the ear loops and remove them one by one or together, then lift the mask away from your face. Discard it safely in the appropriate biomedical waste bin. Final step: hand hygiene with soap and water. Perform hand hygiene thoroughly. Once your hands are clean, you are safe to exit. This completes the donning and doffing procedure. Correct use and removal of PPE is essential for infection prevention and for protecting both healthcare providers and patients from contamination. When performed in the right sequence, donning creates a safe barrier, and doffing helps prevent self-contamination. For more practical clinical videos and learning content, visit www.healthcare-eskilling.com. Thank you for attending the ATC HSSC online training session.